Hey everyone, we are back today with a handheld bioelectrical impedance test today to measure our body composition. So that's what BIA stands for, bioelectrical impedance. This is an easy device, it's non-invasive, it should be super comfortable for your client to be able to do this. It's relatively cheap, it doesn't take a lot of time. It's not the most accurate assessment of body composition, but it's still a reliable one if you use the same one all the time. All right, so there's many different kinds of BIA tools. There's the in-body where you have no shoes and socks on, so it has more points of contact for your feet and your hands. That one's a lot more accurate than this one that's just a handheld one. So how this works is that you put your hands on these little electrodes here, and it sends a low-level electrical current through your body. And as we know, there is more water in muscle, and there's a lot less water in fat. Water is a conductor, so that would mean if I have more muscle on my body, that electrical current's gonna go through point A to point B a lot faster than if there's a lot of fat in my body, it's gonna go through a lot slower. So that's the easiest way to explain how this thing works. So, pre-test. Ideally, your client has not exercised 12 hours before the test because that raises body temperature and changes with a lot of other things that will affect the test. And they have not eaten 4 hours before. This is a little lenient, just make sure it's the exact same every time. When you do tests like the other in-body or you do a DEXA assessment, they typically want 12 hours no food or exercise prior. So as long as you make it the same. So if I tell my client 4 hours no food, they haven't eaten in 6 hours, but they don't tell me that, and then the next time I assess them and they haven't eaten in 8 hours and they don't tell me that, that is going to skew things. So just try to keep it as the same as possible, as consistent as possible. Same time of day, things like that. For females, a big issue that can affect the accuracy is menstrual cycle. So try to have the same time of their cycle. If you can ask them if you feel comfortable with that, just know that it affects that because of water retention and things like that. Hydration's a big one. If you haven't been drinking a lot of water, it is going to move slower through your body. If you're super hydrated, it's going to move faster through your body. So just know that when you pre and post test, there's a lot of factors that play into this that can make this more or less accurate. And again, exercise and food, which we already talked about. So this handheld assessment, this is super easy. You're going to turn it on. It's going to ask me if I'm a guest or not. And I'm going to hit set because I am a guest. Normal height. Yep, nothing crazy here. I'm going to go down till I get to 5'3", a whopping 5'3". I'm going to set it. I am 130 pounds this morning. Set. And then you go age. These are all factors that play into norms. There go. Hold on, guys. Got a little distracted there. I wish. Here we go. Set. And then it's going to ask male or female because that plays into the equation as well. Set. And then I'm going to hit start. Okay? I'm going to hold it this way. All right. So arms are straight, parallel to the floor. You don't want your client to talk while they're doing this. You want them to hold still and just breathe. You guys can see here, it's going to give you your percent body fat, and then it's going to give you your BMI, which it calculates because you put in your height and your weight. So it just automatically does that for you. All right, that is the handheld BIA, and that's how you do it.